If you want the best results working with a pro homeopath, the first thing to understand is this. You can receive excellent care, but no one can promise a specific outcome. Homeopathy is individualized, and the quality of your results depends on the quality of the information you share, as well as your overall general state of health, your lifestyle, your nutrition, physical activity level, stress, sleep, and relationships. The homeopathic visit is not like a typical doctor's appointment. You will do most of the talking. Before the visit, you will be asked to complete an online intake form and sign an online consent form for homeopathic treatment with electronic signature. Be ready to describe your main complaint in detail, along with when it started, what makes it better or worse, and how it has changed over time. Your homeopath will also ask about your medical history, family history, childhood, teenage years, early adulthood, sleep, dreams, digestion, appetite, thirst, sweating, predominant body temperature and weather preference, relationships, stress, and your usual personality in your normal life versus how you feel now as you present with the current illness. Expect a full review of systems from head to toe. It is also important to mention any chemical or electromagnetic sensitivities, surgeries, accidents, trauma, hospital admissions, drug or alcohol use, medications, supplements, and any previous homeopathic treatment. The more complete your story, the easier it is for the homeopath to find the best matching remedy. Even if homeopathy does not rely on disease labels in the same way conventional medicine does, it still helps to share test results, diagnoses, and treatments you have already tried. After the consultation, the homeopath will spend time reviewing all the information provided, adding the essence of your case to a homeopathic repertory software, which will indicate several remedies appropriate to your case. To nail down to one best indicated remedy, the homeopath will choose between 3 to 5 of that list and will read on several different electronic books called Materia Medicas, and by comparing and contrasting between the remedies, we'll make a final decision on the best remedy indicated for your symptoms. This usually takes about 5 to 6 hours of work post-consultation. The homeopath looks for patterns of symptoms, organ affinities, peculiarities that are specific to the case, and uses the essential physical, mental, and emotional symptoms to decide on the best matching remedy to the case. That process can take hours of reading and reflection. Then the homeopath will decide on the dosing frequency and potency of the remedy, based on the patient's level of sensitivity and the nature of the case. Once the patient receives the remedy, it is recommended to take it exactly as instructed. Remember, in homeopathy, less is more, according to the principle of minimum dose. If you improve significantly, especially by more than 50 to 60%, you may decide based on the instruction sheet given to you to stop taking the remedy, even if you still have doses left. About follow-up visits, these are very important. Do not miss your scheduled follow-ups. The process works in a way that either you will book your follow-up online after a few weeks, or at the end of the visit, a follow-up appointment is already scheduled. Follow-up is important to review the initial intake and figure out what has improved or not so much. Sometimes people think nothing has changed until they realize an old symptom is gone or much better. Healing can be gradual and easy to miss. That is why homeopaths usually schedule regular follow-ups every few weeks. It is recommended that you keep following up for at least 6 to 12 months for best results, but some cases will take longer. When improved, well-being may last for a long time, but your homeopath will always be there to help in case you need help again. The takeaway message is simple. Share your story, follow instructions, and keep your follow-ups. That gives you the best chance of getting the most from your homeopathic care.